You're listening to Naturally Speaking, hosted by me, Dr. Dave Wendel, here on the Sound Advice Hour on WCTC 1450 AM, the voice of Central Jersey, and I want to be your inspiration for healthy living. We've been talking about breast thermography this segment. And here's some startling facts. Every year, there's over 200,000 new cases of invasive breast cancer in women. The chance of a woman having breast cancer is 1 in 8. Breast cancer is the leading cause of women ages 35 to 54. Whoa, hold on there a second. 35 to 54. Well, if breast cancer is a disease or a condition that develops over the course of about 15 years plus, yes, it does occur rapidly from time to time, but it's usually something that takes about 15 plus years to develop. If it's the leading killer in women ages 35 to 54, and we don't start testing till 40, we missed the boat on that, didn't we? But to take a young woman and start radiating them at an earlier age, no good. And if we look at the studies around the world, the rest of the world is starting to follow Canada. Canada has now said, you know what, the best time for a mammogram is age 50. And then every 2 to 3 years, depending on what the results are. Because they're finding that having a mammogram earlier isn't saving people. Don't get me wrong. There are many women out there, and I know a few in my circles as well, who have had mammos and have found cancer and have had positive results because of that. But I'm telling you, ladies, it's too late. If breast cancer is a leading cause of women ages 35 to 54, we're too late. We missed the boat. Remember that sesame seed? Put a sesame seed across the room and see if you can see it, right? Yeah, not so easy. Thermography. The specs on thermography start at age 20, and actually it's your first one at puberty for a breast thermography. And then at age 20, every other year, and at age 30, every year. The results are amazing because we can find things years, 8 to 10 years sooner on this platinum standard than what the current gold standard is. Wouldn't you want to find things 8 to 10 years sooner and be able to do non-invasive, real simple things to correct that? We'll talk about that next segment. Listen, 47,000 women die under the age of 50 every year because of this. 10% of all cancers affect women under age 40. More than $15 billion is spent on breast cancer research every year. Ladies, here's the kicker. 80% of the women out there have absolutely no history. None. There are over 1 million cases that are undetected currently. Why? Because the gold standard can't pick it up. Not saying you shouldn't have the gold standard. Not saying you should have it. I'm saying you got to find the platinum standard. Right? Because with platinum, 8 to 10 years sooner, it's remarkable. But let's put this all in perspective, okay? 9/11, we had 3,000 deaths, right? Security, we're now spending $60 billion a year on it. There were 26,000 deaths every year due to automobile accidents, so we made seatbelts mandatory. Yet with 47,000 women dying every year under the age of 50, we don't really have any significant testing. It's really time to step up to the plate. Yeah, so thermography was cleared by the FDA. See, it's a device. Devices aren't approved. Devices are cleared, like a mammogram. Mammograms are cleared. They're not approved. That's the difference with the FDA. That was 1982. 1984, Medicare stopped paying, right? That's when we had the big mammogram push in 84. It's crazy. Right now, there's over 1,500 hospitals just in Japan that are using thermography to help diagnose people. It's incredible. And you say, well, 97% accurate. Come on. That came out of a 2008 Cornell study. And so it's just amazing, absolutely amazing what is out there and what we have available to us to help us. And we don't even look at it. We don't even consider it. So we really need to look and say, what am I really doing for my health, right? So we have a Facebook here right now from Debbie. Debbie writes in and says, I have breast implants. Can I still have a thermography scan? Well, Debbie, the answer to that is yes. Obviously, with a mammogram, you got to be careful because with a mammogram, if you have breast implants, what's going to happen? Well, you have a good chance to, break the implant. However, with the thermography scan, remember, there's no touching. And so as you're taking the scan, you're able to read the heat that's going on. And you say, okay, heat. We talk about heat with thermography. How does that work? When a tumor starts to develop in the body, it puts out a hormone called VEGF, vascular endothelial growth factor. What the VEGF does is the VEGF gets into the body, leaks out into the tissue next to the tumor, and starts to find blood vessels. It attracts blood vessels. So now blood vessels will start to grow towards that tumor. Okay, now think about this. If you have an area of increased blood flow, is it going to be hotter or colder? Good, you're all saying hotter. Excellent. So these blood vessels grow to that tumor. Once they hit that tumor, and it takes a long time, but once they hit that tumor will triple its size in the first year. That's pretty hefty. And so now you have a vascular system that's now feeding this tumor. Because if those vessels don't hit the tumor, what's the tumor going to do? Just going to die. But once that vascular system hits that tumor, something else has happened besides growth of that tumor. And that is metastasis. Because as cells slough off that tumor, they're now in the bloodstream floating to other parts of the body. That's why when you hear somebody that has like breast cancer or lung cancer or something, and you hear, oh, it metastasized to this part of the body or that part of the body. Well, yeah. And it did that long before it was ever found. The problem is you're looking for physical signs. You're looking for the size of those tumors. You're looking for those things around before you're saying, oh, look, it's there. It's there long before it can be seen with our current standard of care. And you have to watch that. These are the things that aren't being told to you. So now think about this. When the blood vessels hit that tumor is going to eat. It's like a hungry dog. Tumor cells eat or consume sugar, yes, sugar, 8 times faster than normal cells. So when the blood vessels hit, the tumor gets to eat. Now think about your diet. If you're under the standard American diet, bread, pasta, cereal, biscuits, muffins, pancakes, waffles, donuts, bagels, cookies, cakes, candies, tortillas, pizzas, all that kind of stuff. All right, what are you doing? You're rapidly raising your blood sugar. You're rapidly feeding the tumor cells. So what's a great way to starve them? Stop eating the sugar. And there's another great way to starve them too. See, tumors, cancer cells absolutely hate, abhor oxygen. Well, if you eat foods that put more oxygen into your system, breathe deeper, exercise, get up off that couch, what are you going to do to the tumor cells? You're going to stop them from growing. Remember, if you don't feed that stray dog, it's going to stop coming. And if you don't feed it and it stops coming, eventually it'll go elsewhere, look for food, or it'll perish. And so the same thing is in the body. Anyway, during tonight's show, remember to call in or Facebook us at facebook.com/healthynj, or you can tweet us at docwendel.com. At the conclusion of tonight's show, we're going to be picking 10 lucky winners from our new likes to win $100 off a breast thermography scan at our office. All new contacts from tonight's show will receive a free health audit from me, Dr. Dave. And right now, remember, you are listening to Dr. Dave Wendel, Naturally Speaking, on the Sound Advice Hour on WCTC, 1450 AM.